This next story certainly won't make anyone green with envy. Look at this pic. What you're seeing, green urine. So hear me out. After a car accident, a 30-year-old man rushed into a trauma center. 2 to 3 hours after surgery, the doctors and nurses were baffled. Why? That was the color of his urine. His urine was literally green. The conclusion, though extremely rare, is that the IV infusion of propofol, which is used for induction of anesthesia, was the reason for the urine turning green. And after this, it was a notification, literally for medical professionals who use propofol, that this can be a possible side effect, although again rare. And those of you probably have heard of propofol, right? And the reason that is really popular, sadly, is because that is reportedly the drug that led to Michael Jackson's death. But I'm curious, how many of you actually look in the toilet or the urinal to see what color your urine is?
We sort of don't have any choice. For women, they have to.
You're lean over to flush anyway. You might as well take a peek, right?
Are you all curious sometimes what it all means? Yes. You're in luck. Because we're about to get to the bottom of it. It's time to spin the wheel of pee. We already talked about green. Let's spin that wheel. Dark yellow, yes, possible dehydration, we know this. Especially on a day where you're busy at work, or maybe you've exercised a little more than normal, if you notice your urine is getting yellower and yellower, it's probably becoming more concentrated. So if you hydrate, that should start to become a little less dark yellow. If it doesn't, then obviously, if it's always that dark yellow, get it looked at. Let's give that wheel another spin.
All right, so this is red, and while I think they're talking strictly about blood in the urine with this red, first off, if you're a woman and you're having your period and you have a little bit of blood or redness in your urine, you're gonna know that's normal. But if you have blood in your urine and you're having some pain, that can sometimes be a sign of an actual urinary tract infection. The big concern is that if it actually is red and it looks like blood to you and you're completely asymptomatic, in some cases that can actually be a sign of cancer. So you do wanna have it checked out. And a couple other things that are not blood related that can certainly turn your urine red are certain medications, eating beets, and certain berries too. So just kind of keep that in mind. It's not always blood and it's not always bad.
And kidney stones too, in some cases. Spin that wheel.
What's coming up? Orange. Orange to dark orange. And there's a reason for this. This could be a sign of underlying problems with your liver, especially if it's associated with light-colored stools. And we know that that liver is involved in filtration and breaking down metabolites in our body. If that's not working quite right, you will get those metabolites in the urine causing that orange color.
You want to do one more?
Should we do one more?
One more.
Sure.
One more
spin.
spin.
Can I spin it this time?
Yep.
White. So as it says there, possible UTIs. So we know that when people have urinary tract infections, they certainly can have white blood cells in their urine and maybe shed some of the lining of the tract there too. That might be those epithelial cells.
And I was just going to add that if it's truly milky white and it's thicker, especially when it's at the start of your stream, you have to start thinking about sexually transmitted infections in that case.
Definitely
because it's one of those things where we always look, and if there's this milky white discharge, purulent discharge, you're worried about more than just
pus,
UTI.
White blood cells, that's signs of an infection.
It is. I know you're sad.
Wait,
but there will be no more wheel spinning.